I mean, I think the important thing is that we know that about 50% of people who have had breast cancer, I know we're going to be talking about all types of cancer, but 50% of people who have breast cancer, we know over 50% of them report and struggle with some sort of a pelvic health symptom, whether it's pelvic pain, sexual dysfunction, urinary incontinence, bowel health. We know that over half of these people are experiencing pelvic health problems, but a lot of them, in fact, I would argue the majority of them aren't getting the help they need because we're not even asking the questions. We also know that at least in Canada, I think it's also around 50% of people diagnosed with cancer will be diagnosed with a cancer that may impact their pelvic health. So half the people, and I know the stat isn't very different in the States. I don't know what it is in Australia and other countries, but that's huge. So we know that about half our population will be diagnosed with some form of a cancer that could impact negatively their pelvic health. Yet again, a vast majority of these people aren't getting the help they need. That is shocking. And I would argue, what's the right word to say? And I think it is negligent of us as healthcare providers, even if this is not within our scope of practice to treat pelvic health. I would say it's arguably negligent that we aren't even asking these questions to get these people to the place they need for the right help. Because the quality of life is massively impacted from these pelvic health problems, even if a cancer has nothing to do with their pelvic region. And there is so much that my profession in physiotherapy and other professions as well can be doing if you've got the right training. And even if you don't have training to treat pelvic health problems, it's amazing. There's a few things that you can do. If it's not referring, even just within your scope, other things. So that's my passion project is getting people this pelvic health that help they need. Does that answer your question, Karen?
Fabulous. We're looking forward to seeing your presentation.